You're watching CBS 2 News in high definition.
And as we continue right here tonight, how old is too old? Hip surgery at age 106. Why did a Bronx woman's doctor perform the risky procedure?
Surgery becomes a risky proposition as we age, but if you make it past 100, it's even more dramatic.
CBS 2's Dr. Holly Phillips introduces us to a remarkable woman who reminds us that age really just merely is a number. She joins us now with more.
That's all it is, only a number. Well, hip fractures are one of the most common injuries in women over 65, and most require surgery. Although operations can be risky in older patients, a brave 106-year-old New Yorker shows us age isn't always a limitation.
I'll be 107 next month, the 18th of February.
Age isn't slowing down Catherine Finaldi.
I enjoy everything.
But she suffered a hip fracture just days before Christmas.
I will answer the phone in my living room. My niece, my granddaughter called me. As I was talking to her, I just slipped on the floor.
At that point, surgery became crucial. If her hip weren't fixed, she could have been bedridden for life, with complications of bed sores, lung problems, or more.
It's very important if somebody breaks their hip that their hip be fixed. No matter what the age of a person, you can't...
Orthopedic surgeon Dr. Arnold Wilson performed a surgery called trochanteric fixation to stabilize the joint. It's less invasive than a hip replacement and requires only a small incision.
The modern device that we use to fix that is an intramedullary device. This device goes into this bone, the femur.
She's now up and around, beginning physical therapy.
That's the goal in treating anybody with a hip fracture, is to get them out of bed and to mobilize them as quickly as possible.
Miss Finaldi's strong health and zest for life made the operation a success.
But physiologically, the way her body looks like the age of a 70 or 75-year-old, even though her actual stated age is 106.
And their unwavering support is keeping her on her feet. Although hip fixation is a safer alternative for older people, it doesn't give the hip the same range of motion as replacement. The decision between the two surgeries is based on the patient's health. She's quite the inspiration.
Yeah, so many questions to ask about this one.
Sure.
But just from the rehabilitation process, how difficult is it? I mean, a guy like Jack Nicklaus gets it in his 50s, and you figure the rehab process is a little easier for him, but even that could be tough. Well, for 106, my goodness.
Absolutely. Well, with the hip fixation, it's a little easier than with a replacement, but the idea is to get them up and moving as soon as possible, and she'll go through a full course of physical therapy.
Yeah, good luck to her.
Our best to her.
She's great. Very zesty.
Thank you, Dr. Phillips.
You're watching My 9 News at 10.
A 106-year-old woman is still kicking after a successful hip replacement surgery in the Bronx. Catherine Finaldi now has a new life. She's recovering from hip surgery by Dr. Arnold Wilson. He says that Finaldi is physically fit like an 80-year-old woman. Finaldi is just fine now, and she says she is free of pain.
The only thing is when I get pains. But outside of that, I'm all right. Thanks to you. God bless you.
Dr. Wilson says Finaldi is only taking Tylenol and will soon walk again after therapy. And as you can see, 106-year-old is really very young at